ever had a cut because you were trying to cook the best dinner for your wife or for your kids? All of a sudden, you had a cut your finger whilst you were working in the kitchen. Or one of your kids was playing outside and just had a cut and you don't know what to do. Most of the time, people are panicking. Now, in today's episode, I want to show you how to clean and treat a cut at home. Now, the first thing you want to do is to stop the bleeding. How do you do that? Put a pressure on it, use a gauze, put a pressure on it, 3 to 5 minutes, hold it, then remove it. If it's still bleeding, apply the pressure again and hold it 3 to 5 minutes and make sure the bleeding stops. If you put a pressure and the bleeding hasn't stopped for over 10 minutes, well, you may be dealing with a vessel that is bleeding more. The pressure is not able to stop it. So what you do, you should see a medical advice immediately so that they can stop the bleeding. After you've stopped the bleeding, the second thing you want to do is to irrigate and clean the wound. How do you do that? Simple, tap water. Put the area where the bleeding is, tap water, irrigate it, or if you have normal saline at home, it's fine. You don't need an antiseptic irrigation because the studies that has been done shown that just tap water is as just good as any antiseptic irrigation. So once you've done that, then the third thing you want to do is to remove any dirt or debris with a tweezer. All right, remove it because there's a dirt in the area. You don't remove it, it's going to cause infection later. Now, what you don't want to do is to put hydrogen peroxide or iodine directly into the wound because that will irritate the area and it will cause prolong the healing time. So don't ever put hydrogen peroxide or iodine directly into the wound. Now, after you've cleaned it, you stop the bleeding. What you want to do is to dry the area with a clean gauze and then put some petroleum jelly on it or antibiotics cream and then wrap it up with a clean gauze or a bandage, wrap it clean. And then you can change the gauze or you can change it every other day so long as you're keeping the area dry and clean. Now, if you never had tetanus injection for over 10 years, it would be a good idea to get prophylaxis for tetanus, right? Now, this is how you treat a cut at home. Very simple, right? But there are certain things you got to know when you need to see a doctor. The first thing is that if you have a cut from a human bite or from an animal like a cat or a dog, you should not try to keep that at home because it easily gets infected. So if you have a cat bite or a scratch or a dog bite at home, whatever it is, you should go in immediately and be seen so that it does not become a worse infection later. Or if the cut is in your hand or in your face or your joints, you cannot bend the joint, you cannot move the joint, that is very serious. You should go to the urgent care immediately and be seen. Or if you have a punctured wound and you haven't had tetanus, prophylaxis for over 5 years, those kind of wounds, you should make sure that you go in and get some tetanus injection as well. Or if you just can't stop the bleeding in the area, you've tried the method I just showed you about, you can't just stop the bleeding. That tells you that you've cut deep into the muscle layer, the fat layer. So you should go in because you might need some sutures on those kind of cuts. Another thing that you should see a doctor is that if even you clean the wound at home and after a day or two you start seeing a lot of swelling, redness, moving up, the redness is spreading, you have a fever, severe pain, or you even have numbness in the area, you should go and be seen immediately. In fact, as far as numbness is concerned, if you feel the area is very numb, even the first day after the cut, you should go in and be seen immediately because you may have cut into a nerve, and the earlier you get seen, the better it is to save that part of your body. So these are the red flags that you should be seeing a doctor for if you have a cut at home. But if you don't have any of these red flags, then you can apply the method I just showed you about and you'll be fine. You don't have to go see a doctor. But so this is how you treat a simple cut at home. So like I always tell you, these days in the 21st century, you are your own doctor. So you got to have certain things in your portfolio. And this is one of the things you have in your portfolio, just in case you need it or somebody in your household need it. So until then, this is Dr. Moses. I say stay well. If you're not subscribed to my channel, make sure you do so, and also give us a like and leave us a comment because we like to hear from you. So until then, stay well.